What is the history of Medicare reform attempts? Have you ever wondered how Medicare has evolved since its inception? The history of Medicare reform attempts is quite fascinating and reflects the ongoing debate about health care in America. Medicare was established in 1965 and has been at the center of health policy discussions for many years. Various reform attempts show the differing views on government roles in health care. From a Republican perspective, these efforts often focus on market-based solutions, efficiency, and cost control while ensuring the program remains sustainable. The conversation about Medicare reform began right when the program started. Initially, Medicare was divided into two parts, Part A for hospital insurance and Part B for medical insurance. Outpatient prescription drug coverage was not included at first due to concerns about unpredictable costs. Early bipartisan efforts combined ideas from both Democrats and Republicans, but differences in ideology regarding government involvement were evident from the start. As we moved into the 1970s and, especially after the Republican Party's shift in the 1990s, Medicare policymaking became more polarized. Republicans began to stress reducing government expansion and promoting free market principles. The Republican takeover of Congress in 1994 marked a significant change. Reform efforts then focused on limiting Medicare's growth and introducing competition and choice for beneficiaries. However, these proposals often faced strong opposition, leading to legislative deadlock. In the early 2000s, Republicans pushed for reforms that included privatization options like Medicare Advantage plans. These plans allowed beneficiaries to receive Medicare benefits through private insurers. The aim was to increase competition, improve quality, and reduce costs by using market mechanisms. Achieving these reforms required significant political negotiation and concessions to overcome resistance from both parties. More recently, Republican proposals have suggested transforming Medicare from a defined benefit program to a voucher or premium support system. This approach would provide beneficiaries with fixed government contributions to purchase insurance. The idea is to encourage competition among private plans and potentially lower costs. Critics argue this could shift more financial risk to seniors, while Republicans believe it promotes fiscal responsibility and sustainability by controlling spending growth. Throughout the years, Republicans have consistently advocated for policies that emphasize personal choice, competition, and limited government intervention. They argue these principles can help maintain Medicare's long-term viability without imposing excessive tax burdens or expanding federal control over health care. While Democrats often favor expanding Medicare benefits and increasing government involvement, Republicans aim to restrain spending and introduce market discipline as practical solutions to the program's financial challenges. The history of Medicare reform attempts from a Republican viewpoint highlights a continuous effort to balance providing health care to seniors with ensuring fiscal responsibility through market-based reforms, competition, and controlled government spending. These efforts reflected broader conservative principles of free market economics and limited government intervention in the economy.